Thanks very much to the All Ireland Institute for the invitation to speak with you today and to meet you all. I just took up this post this year, so I'm still getting to meet people from the wider palliative care community in Ireland. So I hope to talk to a lot of you this morning on the breaks. Karen has asked me to tell you a little bit about my role and also give you an update on some of the palliative care developments in the Republic of Ireland and maybe what lies ahead. So a little bit just about my role. As National Lead for Palliative Care in the HSE, I lead the strategic planning within the HSE for the development of palliative care services. That involves working collaboratively with HSE colleagues nationally in acute operations and community operations, the HSE service providers, the voluntary providers and the HSE clinical care programme to ensure that we provide a cohesive approach to the services that we develop and deliver. My role involves liaison with the Department of Health on the planning and delivery of palliative care services, including developing the business cases for the annual estimates process. So that's where we, I suppose, seek new funding for additional workforce and additional service developments. I support the monitoring delivery of palliative care service objectives and targets that are in the National Service Plan, and we're at the moment developing the National Service Plan for 2023 and the palliative care objectives as part of that. And I oversee the palliative care metrics and targets and provide analysis on the performance data for our HSE colleagues and the Department of Health. So that's a little bit of an overview of the role. Just in terms of where it sits within the HSE, and this is I suppose, a bit of an organogram for the HSE as it is at the moment, and going to be changes, as some of you know, with our regional health authorities being introduced in 2024. But in terms of the national function, palliative care sits under integrated operations. So you may have heard Van O'Connor. She was the chief operational officer, and now it's Damien McCallion. And underneath him, there's acute operations and community operations. You look after the palliative care services in primary care and in the acute hospitals. And where the National Lead of Palliative Care sits is in service planning. So I suppose it's more of a strategic role, supporting the implementation of policy, advising acute operations and community operations in terms of service developments, and providing them with the intelligence that they need to, I suppose, deliver and monitor the services that they are tasked with. I might just keep moving on. I suppose I just wanted to mention, maybe just in terms of, and you all know the key policy developments in the Republic of Ireland, but I think I suppose came from mental health where most of my career was, and I suppose I'm impressed really with the quality of the policy in terms of palliative care, both on the department side and the HSE side. And I think if you look at the last 5 years, you know, from Sláinte Care, which I suppose identified that palliative care should be part of universal healthcare provision, and I can see, how that decision, if you like, is beginning to filtrate down into the services that we plan and deliver. The HSE 2017 three-year development framework for palliative care, the HSE 2019, the model of care for adult palliative care, and in children's palliative care, the 2020 Professor Bewe report into the clinical governance and operational arrangements for supporting a model of care with children with life-limiting conditions. And then, of course, Professor Karen Ryan is leading the steering group that's going to hopefully deliver the new adult palliative care policy next year. So just a couple of recent developments, just keep an eye on the time there. I suppose in terms of 2023, I suppose the capital developments, the progression of, I suppose, the new specialist palliative care units for the Midlands and the North East. It's long been identified as an area of inequity. And I suppose the Taoiseach announced in September 20 million to progress, for the Midlands Hospice in Tullamore, and there is capital development committees progressing Cavan and Drogheda. In 2023, we got additional workforce for children's palliative care in line with the Bewe report recommendations, and particularly extra CNSs for adult palliative care. We have to mention the increase in the number of advanced nurse practitioners for palliative care. We got an extra 10 this year. And other key pieces have been the establishment of the Carew Nursing Home Programme. So in terms of generalist palliative care, that's a programme that the Institute here and the Irish Hospice Foundation, along with the HSE, are leading out on. And it's really about enhancing the skills and the knowledge among the staff of nursing homes in Ireland so that they can deliver quality end-of-life palliative and bereavement care. And of course then the government decision to redesignate the 4 voluntary hospices from Section 39 to Section 38 agencies, going back to that Sláinte care decision that, palliative care really isn't a nice to have. It is essential part of the health services that are delivered. So in terms of the challenges ahead, I suppose, ensuring equitable provision of palliative care services, and I suppose it's easy to say it, but I suppose what we need in order to do that is better, I suppose, intelligence in terms of data, better information about the types of services, better information about where the inequities are. We need to enhance the generalist palliative care, and again, we need to know where should we be. What our decisions are needed, where should we be investing our funding in terms of generalist palliative care. So going back to, I suppose, the people in our research community, this is the information and the guidance that you can support us with. We need to integrate our palliative care within other models of care for all people with life-limiting conditions, and develop a clear vision and plan for out-of-hours service provision. And a big challenge going forward is our workforce, and particularly workforce planning and recruitment, which is obviously across all services. So I won't read through this slide, but I suppose in terms of opportunities, the last one, that opportunity for further academic and clinical collaborations in research, and I know there's a presentation on that later this morning. So I suppose again, coming from maybe mental health to palliative care, very impressed by, and I know the All Ireland Institute play a really key role here, how they broker those relationships between the clinicians and the researchers and the organisations that provide palliative care. So I think, it's something as a national lead, I'm very interested in how I can support those collaborations, and look forward to working with you all over the next few years, hopefully, in terms of doing that. So thank you very much.